Hello and welcome back. My name is Dr. Martina Assad, and I'm the owner dentist of MAE Dental. We are located on Van Buren in Riverside, and today we're going to be talking about dental crowns. So, what are dental crowns? And dental crowns is pretty much a hat that goes on top of your tooth and it covers it up. And comes in either silver or white, or a combo. Sometimes they come in gold as well, or a combination of either or. So, are there any alternatives? Which is an excellent question. Some offices and some dentists do an alternative of a dental crown. And instead of doing the full hat, they do half of the hat or like a three-quarter of a hat. And people get pretty smart about it, which is called inlays and onlays, which is a topic for a different day. I personally don't necessarily favor inlays and onlays for a topic or a different reason for a different day. I prefer the full hat so you can function and you don't have any restrictions anymore. Even my veneers, I do them as full hats, like call them full coverage veneers or aesthetic crowns. What types are there? There is Emax crowns, which is like a glass material, very aesthetically pleasing but very weak. It has to be very thick for it to withstand forces. People that grind and clench, they can't use those usually. The second crown, there's porcelain fused to metal, and it's that porcelain glass material and metal underneath. Also has its own disadvantages. That metal collects plaque and also breaks. Sometimes they detach and the metal stays there. There's also gold crowns, which is the mother of all crowns. A lot of dentists in the past used to favor gold crowns. The advantages of these are they're very malleable and soft, but yet they're very strong, so they act like a natural tooth. And they last close to 50, 60 years sometimes, which is great. The problem is the color. A lot of people don't want gold anymore, and the cost. The cost is goes by an ounce of gold, which is a lot of people cannot necessarily or don't want to gravitate toward that. And then sometimes people get created about types, and depending on for whatever the reason is, there's porcelain fused to metal, there's porcelain fused to gold, which is porcelain and gold together, and the type that is most common now that we all use is zirconia crowns, which is made out of like the zircon or the like the. It's a beautiful material. I have came a long way. It's very aesthetically pleasing now. Very thin. We don't have to shave the tooth down quite a lot to put a zirconia crown or a thin hat versus the other type of hats. Is dental crowns are necessary after a root canal, or just because you got a crown, do you need a root canal? I get this question mingled a lot. So if you do need a root canal, like if you're cavity into the nerve and you're having severe pain and you're waking up at night and you do need a root canal, because we make a pretty good size hole in the middle of the tooth, especially the back teeth, they become almost like hollow, like an eggshell. The best way to protect the root canal treatment that you got is to close it up and put the hat on top of it. Front teeth are different, depends on how much the structure is missing, but the common denominator for front teeth is if you have a little tiny hole in the back of your tooth and no one can see it, usually you can pluck it with a bonding or a filling. But for back teeth, because they have wider surfaces and they're designed to chew, you do not want to leave your hole open. It can get your root canal infected again, or the tooth can break in other instances. As far as the other counter argument of it, do I always have to get a crown? Do I always have to get a root canal with a crown? And the answer is no. You do not necessarily need a root canal for every crown you get. If the if the middle part of the tooth is affected or infected or you're having severe pain, this is the only time where you need a root canal. Other than that, if half of your tooth is broken but the cavity is not into the nerve, or if it's an aesthetic area where we have to crown the tooth, or let's say you're missing part of that pointy part of the tooth we call the cusp tip, crown is a great idea. Otherwise, you start to break the tooth. So let's talk about the dental crown procedure. It's very important to understand. It is somewhat of a lengthy process, but very comfortable one. So we first evaluate via X-rays and exam, make sure that you're a candidate for the crown needed. Then we take your detailed health history and we check your blood pressure the day of, make sure like if we put some anesthetics or some medicine, like it doesn't interfere with your health history. And then after that, we take a little, it's the only time we take a mold. It's like a little putty that you bite in. It's not full, it doesn't make you gag, And then that takes a replica of the current condition of the tooth. So we can make you temporary crowns later. After that, we will make some room for this hat, a very thin hat, take the old filling out, take the old cavity out, build it up, literally build it up with material called the build-up, which is similar to bonding. Then after that, we do everything digital. So we have a camera that goes around your tooth. We put some medicine around your gum line to kind of show the lab that beautiful edge. And then after that, we make your temporary crown. We check, make sure it's seated. We glue it, and then bring you back for appointment B to give you that beautiful new crown. Does it hurt when you get a new dental crown? And it varies from patient to patient. If I tell you like 100% of patients don't get pain with dental crowns, I'll be lying to you. A lot of us, we do our best. We've got to remember, you're numb during the appointment. A lot of times you can't feel how you're biting. If your bite is off, that causes a lot of pain. So I always tell people, when the anesthetics wear off, let's bring you back, check. If you're having issues, if you're maybe didn't follow directions, you will have some pain with it. Now, if we're talking about the delivery aspect of things, usually the first few days, people are sensitive to hot and cold, but it shouldn't be something that one ibuprofen won't fix. And then if it's, when things go, as things kind of like settle in, you will have no pain with your dental crowns. So in the beginning, maybe you'll be sore from the work for about a few days, but that's it. Now, if you're having pain that lingers, you need to call us right away. Consequences of getting dental crowns: if they're needed, nothing negative. And if they're done well, nothing negative. I've seen crowns last again 50, 60 years because they were done really well. Let's be realistic. Human beings don't even last 50, 60 years sometimes, or even our shoes, our cars are. So if they're done skillfully and they're done well and nothing is opened, you will have a really good time with them. And let's say you're doing so many of them, you need a night guard or a retainer, recommend it. They become very harmful, I'm going to be honest, if they fall in the wrong hands. If the teeth are shaved down way too much, or if they're using the wrong material for the wrong patient. Or, for example, if the patient is allergic. I've had some of my patients who are allergic to metal. So we needed to revamp the plan. And that's the reason why I no longer use anything with metal, because I'm not sure who's allergic and who isn't. And also the material isn't as nice. So it can be very destructive, like very destruction to the max if, again, the fall in the wrong hands, or the patient waited too long to get in and now the tooth is about to break. It's pointless to do a crown at that point. Children's teeth, is it worth it to put crowns on them? And the answer sometimes yes, if the hole is too big. Baby teeth are so small, and if the child is not ready to lose the tooth just yet, they're not at that age, if they lose the tooth too early, they start to get crowding. So sometimes we want to keep the baby teeth in place. And yes, we do want to fix them, because you don't want to leave a cavity on them, since the permanent tooth, as it comes in, it will come out with a cavity most of the time. So it's super important for us to put a caps, so when the child is biting, they're not breaking their tooth, or they're not losing it altogether. And that will kind of be a space holder for us to guide the permanent tooth out, which is so worth it, better than space maintainers and other complicated procedures. So yes, we do it on a lot of instances. With the cavities is great. A lot of people think with crowns you don't get cavities or you no longer have to put up the work. The answer is no. Cavities on teeth, no matter what you have on it, that still happens. It can happen underneath the crown edge, or if you have dry mouth, or there's a lot of consequences if you're not doing a good job with oral hygiene. So please, if you have crowns, it's just like anything else, like dental implants, like fillings. You must follow hygiene protocol, proper brushing, flossing at home. You need to go to your dentist at least once a year to take x-rays, make sure nothing is developing underneath that crowns. Usually cavity develops, let's say if this is the edge of the crown, right here, cavity would develop right underneath it, or at the opening if the crown is slightly open. So maintenance is super important. Nothing, again, is permanent. Even us, we're not permanent. So please make sure you brush and floss, because just because you got a crown, that doesn't mean it can get infected or cavitated. With that said, that pretty much concludes our video for today. I hope I was able to answer some of your questions that you may have. If you do have any more questions, comments, or concerns, please do not hesitate to call us at 951-327-7247, and I'll be more than happy to schedule you an appointment.